Weekend brunch is a popular Toronto pastime, but should alcohol enhance that experience? Well, the City of Toronto is currently considering allowing businesses to serve alcohol earlier. The medical officer of health is raising some serious concerns with what this means for our health. Dr. Eileen Davila penned this report with recommendations for the city's Board of Health on the impacts of alcohol consumption, which she says is the leading risk factor for acute harms and chronic disease in Canada. Toronto Public Health told City News that she would only be available to speak with media at tomorrow's board meeting. She notes that there's been an increase in consumption, particularly amongst women. Councillor Paula Fletcher supports the motion to have alcohol served earlier, but notes there are health considerations.
We do have a lot of alcoholism in our city, so we do have to be concerned about that. But there are businesses like this one that want to be matched up to the alcohol sales time that exist at Loblaws, and I think that's fair.
Have we ever done studies, or are we aware of what the impacts of early alcohol consumption are?
Nobody's looked at what it means to open this up. Now, you can go down, you can leave today and go to Loblaws. You could have been there at 9 buying a bottle of wine. I think I'd rather have somebody buy a glass of wine than a bottle of wine at 9 o'clock.
Fletcher has been leading the push to allow restaurants to serve alcohol at 9 a.m. on the weekends instead of the current 11 a.m. Other city councillors are on board, and they voted to ask the province to change this regulation. The medical officer of health, though, isn't quite convinced, and this science communications expert says Dr. Davila's concerns are valid.
My concern with allowing alcohol consumption to start at 9 o'clock in the morning would be, and I think this is a question that the public has to ask themselves, why do you need a drink at 9 o'clock in the morning?
The argument that, some people are making is you can go buy that alcohol yourself at Loblaw. So what would be the difference?
I'm actually not opposed to the difference in terms of, I think it's nice to be social with friends and to go out, and I think around food and alcohol consumption, it actually tends to be healthier when people do it in the company of others.
Dr. Davila also providing a figure from 2015 and 2016 showing there are now more alcohol-related hospitalizations than heart attacks in Canada.
I think that we have to make sure that we put public health ahead of commercial interest, and I think that as long as we think about the health of Torontonians, listen, I'm not saying don't go and have a Caesar with brunch, but I don't know that you need to have that Caesar at 9 in the morning.
In that report, the medical officer of health says TPH is also in discussion with other city partners, including Toronto Police, paramedics, and Parks, Forestry, and Recreation. For City News, I'm Faiza Amin.